really worse premenstrually. Then when you treat them, their depressive episodes, they get a lot better, but they still tell me if they had to judge, they get worse. They're worse premenstrually than they are any other time of the month. So, yeah, I think that's just, unfortunately, that's one of the disadvantages of estrogen and progesterone, I think. But I don't know. Any other questions? Yeah.
What do you do before prescribing any kind of medication? Do you do any kind of, when you talk to or depressive people, prior to that diagnosis of medicating, what's some of the things you can do?
So you're asking if somebody comes to see me, and you're saying they have depression, or?
Yeah, they think they're not sure what they've got. The family member brings them.
Family member brings somebody in, and to see me, and so you're asking me how do I go about diagnosing?
Yeah, is there try these other things prior to medication, or is it always just going to be?
No, it's not always medication.
Okay. So what's some of the other things that you would do that they could do to help themselves?
Oh, okay. So some of the things that folks can do to help themselves. Let me just. I'll tell you how I approach this. Okay. And realize I'm one physician. I don't have all the answers, and other physicians out there watching this thing are probably going to, oh, I don't agree with them on this or that or the other.
That's saying, oh, I'm so depressed.
Yeah.
It's a gloomy day.
Yeah.
I do this great day. Going, okay, is that this? Is it that?
Yeah.
And everything in the world's negative.
Yeah.
Yeah, and it's just like, okay, I know what I do to get out of that. What do you do to help someone else get out of that?
Right. There are a lot of things you can do to treat depression that are not medicine related, okay? And there's actually some data on this stuff. There's some studies on this stuff. Exercise, aerobic exercise is one. Cognitive behavioral therapy is another. That's a type of therapy where, if you think about it, a lot of us that have these negative thoughts, we call these things, cognitive behavioral therapists call them automatic negative thoughts, okay? These are things like, boy, I'm just really no good. Everybody sees it. They all know it. I know it. I'm no good. I can't do anything right. And so it may not, you don't say it out loud, but you think these things. These are automatic negative thoughts. They occur a lot when you're depressed, okay? Sometimes they occur even when you're not depressed, and you can make yourself depressed by having all these things, right? Some of these things occur because you were raised in a way that sent you that message. You were always raised that you were not good enough. You were put down all the time. You're fat and ugly. Get out of here. I'm sick of seeing your face. That kind of stuff. And believe me, it shocks me too. There are parents there are people who do treat their kids this way. Okay, you guys know that. Right out there shaking their heads. Anybody that's had any dealings with with mental illness and treating folks with these things knows that this is what happens in a lot of cases. Well, you can't be told that your whole life growing up. Especially during the years that you're forming the opinion about yourself, and you can't be expected then to grow up and have this wonderful self-esteem and walk around thinking you're all that in a bag of chips, right? It's not going to happen. You're going to walk around thinking all these automatic negative thoughts about how crappy you are, okay? One of the ways you can help with that is to really start challenging the person on those thoughts, okay? And that's what cognitive behavioral therapy does. Basically, and it's kind of sounds goofy, but you send the person home and you tell them, here's a mood chart, here's a thought record, and a thought record is where the person, first thing they usually notice is they feel bad. That's all. So you tell them, okay, next time you feel bad, I want you to think back now, what thought did you have right before you had that bad feeling? Well, I thought, so they take it home, they decide that they were depressed, okay? Well, the thought that they had right before that was, I'm no good. And then you have them actually weigh the evidence, for and against the fact that they're no good, okay? So you have them do little things in your office like, what would your friends say? What would your wife say? What would your kids say? What would your boss say? What do you think everybody else would say, And then what's the evidence that you are worthless? They may say, well, Dad told me that all the time growing up. And that's it. So you show them that, okay, so all these people think you're not worthless, and your dad said you were, and you're going to think he's got all the answers? What's up with that? So you start challenging them to think like this, to challenge how they think about the world and things. that can help lift depression. Believe it or not, in study after study after study, that's been shown to help with depression, but not only depression, anxiety, schizophrenia. It's been helpful for a lot of different psychiatric problems. So that's one kind of psychotherapy. There's a whole bunch of different kinds of psychotherapy. The one thing I would say is, you sort of alluded to the question of how do you know when to use medicine versus psychotherapy alone. I would always start with psychotherapy unless there are some things that are, and I guess the short answer to that is it's through experience. I've got enough experience now that I can sit with somebody, take a good history, and figure out, do I have the luxury of time to wait for the psychotherapy to work, number one? Can the person focus well enough to do the psychotherapy? If they're so depressed that they can't concentrate, memory is shot, how are they going to be able to challenge their thoughts and stick with me in sessions and things like that? Those folks, if they're psychotic and they can't, all they can think about is that they're condemned to die because they sinned. You can talk about challenging that thought. It's not going to happen. Okay, those folks need medicine, and really, if you don't use medicine pretty quick, they're going to end up in the hospital. So I guess I take the history and I sit with the patient and the family and I kind of figure out how bad is this? Is it pretty darn severe? And if it is, we got to do medications to start with, or treat, ECT or something, some other type of medical treatment. And certainly, as soon as we can, we'll get the psychotherapy going. But they got to be able to focus and stay with us and things like that. So, does that answer the question? Yeah. Okay. That's a good question, and we haven't really, I guess I'm a little remiss because I should have talked about that in other sessions, a little bit about what a psychiatrist, maybe that should be some talk sometime, what a psychiatrist really does. I think a lot of people think I'm like a head shrinker, they either come into my office, I'm going to I don't know, read their minds or something like that. It's really not like that at all. It's just like any other physician, only I don't do a lot of laying on of hands. I don't do a lot of stethoscoping and reflex checking and all that stuff. It's if I have to, I will, but mostly it's sit down and talk to me about how things are going and take a good history about your medical history, psychiatric history, and then all these symptoms. I have to unfortunately put the person going through all these symptoms that I put you guys through, and screen them. Basically, it's called a psychiatric review of systems. It's a way of asking a lot of different questions to rule out. I do childhood history, drug and alcohol history. You do a mental status exam. It takes a while. It takes me a long time. It takes me about an hour and a half usually to get through something like that with a person. So it's, but that's time well invested because then they learn about you and that they can trust you, but also you get a better idea what you're dealing with, and you're better able to treat them in an appropriate way. Sometimes you don't spend enough time with a person, you don't really know what you're treating, and then you try something just as a stab in the dark and it doesn't work, and that's not really ideal. So, other questions?